Welcome. Welcome to NEHTA and APNA's introductory webinar to eHealth for primary healthcare nurses. Thank you for your attendance. Really looking forward to today's session. And without further ado, I'll introduce myself. My name is Cassie Farrell from NEHTA, and I'm the Customer Care Manager. And without further ado, I'll send you across to Julianne Badenoch, who is the President of APNA. Over to you, Julianne.
Welcome and thank you everyone for attending the first of two webinars brought to you by NEHTA and proudly supported by APNA, introducing eHealth for primary healthcare nurses, including practice nurses working in general practices. My name is Julianne Badenoch, and yes, I am the current President of APNA, which is now the Australian Primary Healthcare Nurses Association. I'm also a clinical governance advisor with NEHTA. I have a passionate belief in the need for eHealth, and for the need, if not the urgency, for eHealth to become fully integrated into our normal daily lives. I believe every Australian should have access available for themselves or their chosen representative and or their clinician to their current vital and certainly important health information. But I believe an electronic health record helps to ensure safe and appropriate health care whenever and wherever it is needed. Whilst I have a relatively long-term involvement with eHealth through my roles as President of APNA and as the Clinical Governance Advisor with NEHTA, and also on other various national eHealth advisory committees, I believe my most important roles, truly, with regard to the national eHealth agenda, go beyond this, and many of you may actually relate to this. Firstly, I am proudly a grassroots registered nurse working in general practice in rural South Australia, working with young families, many of whom are fly-in, fly-out, but predominantly with an ageing and mobile population, lots of grey nomads as such. Secondly, I'm the carer of my 82-year-old ageing mother, who has significant chronic conditions and requires multiple care providers on a regular basis. And thirdly, like all of us, I too am a consumer, and at the upper end of middle age, I say that with a smile, am well aware my own health needs may increase in time. Today we bring you an introduction to and the foundations of eHealth and the overview of the Australian eHealth record system. We'll look at eHealth benefits for clinicians, in particular nurses, and how it benefits individuals or consumers, as I will refer to them. You will also learn how to prepare and how to access the eHealth record, and finally where to next, and I would encourage you to take the opportunity to ask questions, particularly of my colleagues who are truly the eHealth experts. Why is this webinar important now? APNA and NEHTA have long believed in the important role nurses do play in general practice, and in particular their roles with safety and quality and change and adoption of new systems. We live in very interesting fiscal times, and I believe never has the need for available and accurate personal health information been more important. Looking at general practice, nurses constitute a significant and rapidly growing part of the workforce. Now with well over 12,000 primary healthcare nurses employed in general practices right across Australia, that puts us in every community within Australia. Unlike other clinicians, we're out there. Nurses intrinsically have quality and safety as a core factor in the holistic care of their community, and we know nurses in general practice settings already play a key role in the maintenance of clinical health records, particularly through our significant role in care coordination and chronic disease management, which has become core business for us. Care coordination, management planning and health assessments provide, I believe, perfect opportunities for updating and ensuring data accuracy and providing good incentives for general practices to ensure nurses have the time, space and opportunity to spend with consumers, thus saving GP time and allowing them to get on with what they need to do. Nurses undertaking this work within general practices can also allow the practice to more fully capture clients with chronic and complex conditions who may not already be receiving optimal care coordination. We know nurses also play a central role in things such as childhood and adult immunisation, wound care and delivery of other types of care which require ongoing documentation. Data cleansing and quality coding will ensure good data transfer with uploading of documents to our EHealth records. Nurses should be able to do this during most encounters with consumers by ensuring their data is accurate and current, and every time we engage with a consumer, ask questions, get rid of what is inaccurate, and fill in important gaps in clinical health systems. We know many general practices often rely on nursing staff to ensure quality and consistency of clinical record management. Therefore, I believe general practice nurses in particular have the potential to be significant enablers in the transition, implementation, and certainly the uptake of the EHealth record. Nurses can also do this by taking opportunities to align EHealth literacy and uptake by their consumers and the clinicians they work with. Some of these opportunities are through data cleansing, as I've said before, both planned and opportunistically, and actively engaging and educating consumers, which will result in increased understanding of the benefits and basically demystifying EHealth for them and for all of us around us. And also by assisting and or engaging consumers for registration. Care coordination and care planning consultations for those with chronic conditions are another opportunity. And also optimising any captured time with parents during immunisation consultations. And also best utilising other opportunistic consultations, especially when offering preventative health advice to younger or at-risk populations. Finally, I'd like to say, I know if we make a really conscious effort to prepare, get on board now by investing time up front and hopefully building it into our core work, I know we as not only practice nurses or primary healthcare nurses working in general practice, but also as consumers will see great benefits in the long term. I'd like to now introduce Heather McDonald, who's the manager of the Clinical Usability Program and Adoption. I hope I got that title right. And most importantly to me, Heather is an EHealth nurse guru of whom I am truly in awe. Thanks, Heather, and over to you.
Thanks, Julianne. In awe. I hope I can live up to it. Welcome, everybody, to this webinar. It's fantastic to have so many nurses interested in supporting this program. So what will happen today is I'll talk for a while, probably about 30 or 40 minutes, and during that time we'll be sending out polling questions. I'll just give you a highlight when they're going to come. In fact, I think we're going to send one out now. If you can respond to that, we'll get the results, and then we can talk about what the results might be. This is not only just to make you feel like you're participating, but it's also to give us some information. So the first poll's coming out now, asking about what sort of setting you're in. So what we're going to do today is go through some introduction. So what we want to do is just the foundations of what is eHealth, what foundations have we put in place already, what's the record system, how is it working for each person, how can we register, what are the different terms and portals. So really to demystify what eHealth is. Now, at any stage of the webinar, if you feel like asking a question, please just type in questions, and we will be leaving time to respond to all of the questions that you ask us at the end of the day, at the end of the session. This is the first of two parts. So today is just an introduction. Next week, what we'll be doing is going into detail of how nurses can contribute to being part of the eHealth process, because one of the things is we don't want to have new workflow in systems. So at the moment, there's many of the GPs and hospitals are sending up discharges or shared health summaries, but the use hasn't been as good as we'd hoped, and one of those reasons is because it doesn't actually fit into the workflow. So we have to work out what the workflow is and how can we enhance the workflow to use this eHealth system better. And part of that, I think, is the role that nurses play in each of the in each of the sectors where they work. Okay, so let's get started. So if I can work this, we'll do better. So what is eHealth? So most of you are familiar with electronic health in some shape or form, I'm sure. So it's about the collection of management, use, storage and sharing of healthcare information. We already do that in all of our sectors, but often it's by paper. So what we do is we're highlighting the lack of interoperability. So currently everyone's got their own systems, but they're unable to share. As you're aware, if someone goes into hospital, their discharges get to you some way or other. But sometimes patients think that you, as a GP practice, you'll know they've been to hospital. It's not always the case. Okay, so and one of the things is sharing between sectors. Secure messaging comes from different systems. There's a lot of scanning. We'll talk about the cost of that. Many practices are scanning up to 20 hours a week. And clinical safety risks. There's risks in using paper. This risk, while electronic health introduces its own risks, different risks, it does mitigate some of the risks. One of the problems that we've encountered is the GPs don't see a lot of benefit for themselves, but the benefit is really for the patients. And so we have to focus on where the benefits are best gained. But we will talk about that afterwards, later on in the session. Okay, one of the first things that has occurred within the eHealth is the healthcare identifier. This was introduced in June of 2011, and it's run by the Department of Human Services, which is the old Medicare. So most of you know this about Medicare. Now everybody has an HPI, an HII, a healthcare identifier, an individual healthcare identifier. This is given to everybody by Medicare, and as a health professional, you will have an HPI. Now, this is different to your registered nurse number. So you've got a registered nursing number, and then you'll have an HPI. So if anyone's registered with APRA, regardless of the profession, they have an HPI automatically. Now, to get this, all you need to do is phone APRA, and they'll sort out how you need to do it. We'll talk about that. So the slide you can see talks about the right information. So an HPI is about who provides the service, so that's the health practitioner. The IHI is the individual healthcare person receiving the care, and an HPIO is the organisation. We will go into this a little bit further, but so the organisation has an identifier, the provider has an identifier, and the individual has an identifier. So that's what is made up of the healthcare identifier. Now, you're about to get another poll to find out how many of you actually have healthcare identifiers. So when we talk about, the other thing as part of the foundations is the National Authentication Service for Health. You've probably seen this in the newspapers. It's the NASH certificates. You probably saw this in the press when NEHTA was trying to run the system and it didn't work out with IBM, and now it's been taken over by the Department of Human Services. This is a necessary evil, so to speak, because it's about security. And we absolutely need security in this system, and that's why it's there. So the NASH certificates, there's two types of certificates. There's one for the organisation. So when the organisation registers to get their healthcare provider organisation, HPIO, they also at the same time get a NASH certificate. This is authenticated every time they access the service. They know it's that organisation putting up documents or downloading documents. An individual also needs a NASH certificate. So as HPIIs, all of you who are registered, once you can get an HPII, you'll be able to access the provider portal using your individual NASH cert. Now, you can't use an organisational NASH cert to access the provider portal. Secure messaging is something that NEHTA's been working on for a number of years. It's now an Australian standard. It was, and so the idea of this secure messaging is to have interoperability. Most of you are familiar with messaging systems. In fact, you probably have half a dozen systems if you work in a general practice. Providers, an example of some providers would be HealthLink, Argus, Global. Your pathology provider sends you messages securely via their messaging provider. So I'm not suggesting for a minute you don't have secure messaging. It's just not interoperable. So the SMD was to ensure that all messaging vendors were interoperable. This is still a work in progress, and one of the main reasons it's challenging is because of the commercial model of the messaging vendors. So this is being worked on, and there's been a huge progress recently. There was a couple of projects run to work with the different vendors. I think there's 3 or 4 now that are starting to work together and use the secure messaging system. So that's kind of how it works. All right, so they're the foundations. Now, once the foundations were put in place, NEHTA and the Department of Health have worked to get the PCHR up and running. I'm sure you're all very familiar with it, either personally or by reading the paper. Anyway, the budget was terrific, and we've got money for another year. So let's get it working well and go for it. So if you all enrol and start using it, that'll be of great help. So what is an eHealth record? It's a secure electronic summary of the patient's record. So the optimum word in this is summary. It's not the entire record. It's just a summary that's being sent up by the providers. So you can see around the circle, the patient is in the middle, which is why it's called the personally controlled. So the patient has that control, and they can set access levels, and they can manage their own record. So you've got the people in that circle, which include family members and carers. So you can give access to a carer if they're caring for you. You've got allied health practitioners. Allied health people, if they're registered with APRA, which is the predominant, physios, speech therapists, those sort of people, they have an HPII and they can provide care for them. They would be more likely to be sending up event summaries. Pathology will be pathology and diagnostic imaging is planned to be able to be entered into the system by the end of the year. There's a lot of work going on now. The rumour is that it'll be done by November, but I suspect it's more likely to be the beginning of next year. Specialists, we've started working with the specialists to start getting them using it and to work out what their workflow is and how we can enhance that. Pharmacists, there's over 1,000 pharmacists that are registered, and they're sending up dispense records, and I'll show you what that looks like shortly. So when you go to the pharmacist, if they're connected, the predominant users are Aquarius or Fred. If they've got either of those systems, they'll send up a dispense record if you've got a PCHR record. The next ones are, what are those little people? Hospital staff. There's 161 hospitals that are currently sending up discharges. So if anyone goes to any of those hospitals, they will get a discharge sent to the system as well as point-to-point. And the GP, there's nearly 5,000 GPs that are registered with the system. Okay, so where's this information coming from? So we talked about that they've got a series of information in their record. The patient is one source of record, and you can see there what the patient can do. So they can keep if they go to a GP or a specialist or a hospital that isn't participating currently, they can keep a summary of what's happened there themselves. Or if they don't go to the doctors and they've got allergies, they want it to be highlighted, they can put that in their own system. They can put personal health notes, which might be useful for somebody like a diabetic who may want a record of their blood sugars on a daily basis. As you know, if people are recording these things, sometimes it makes them better. So that's what's happening there, and they're able to do that. They might just want to put in exercise and diet. They can do what they like in their personal health notes. That's not seen by anybody. It can't be seen by providers. But if a patient wants a provider to see it, they might take their iPad in and share it. Child development information, again, that's just to a record of your child development. And advanced care directives. Oh, I was going to get you the numbers for that. I will for next week. There's quite a lot. Oh, we've got the numbers. No, the advanced care directive. Sorry. Cassie's misleading me here. You can't see her, but I can. Okay. The health professional. Currently, we can put up shared health summaries. All of the clinical information systems that are in GP and about 4 that are in specialists are able to send up shared health summaries to the system. Event summaries can be sent up by the same providers. Discharge summaries are coming from predominantly public hospitals, but there are some private hospitals. St Vincent's Private in Sydney is sending them up. And we're in negotiations with some of the other private hospitals to talk about how they could participate in using e-discharge. E-referrals and specialist letters are available. They're not currently being used very much. In fact, I can tell you what we've got up there at the moment with these documents. There's 20,000 shared health summaries that are up there currently. There's 31,740 discharge summaries. There's 1,200 event summaries. And then prescription and dispense records. There is 157,000 prescriptions. So they've come from GPs who have created scripts, and then they're going to the patient as well as up to their record. And there's 125,667 dispense records. So you can see the prescription and dispense is going to be one of the most used views, which is very useful because medications are the biggest benefit in sharing records. And in 2014, hopefully by the end of 2014, we'll have e-discharge imaging and pathology reports. Now, the other thing that's in the system, and if you have already got a record in the PCHR yourself, you will have noticed that there's the Medicare data. So the Medicare data is all your MBS, PBS. If you've got a childhood immunisation register, I think it only started about 12 years ago. So if you're an adult, you won't have anything in there. And the donor organ register is there, and DVA claiming. Okay, is the record secure? Well, a consumer can put the privacy on their information, so they can put some levels. There's 2 levels. There's LDAC and DAC. Don't ask me what they stand for. That's good because you can't, because I can't hear you. You might want to, though. But next week we'll explain that a bit more. It is on the ehealth.gov.org site. So what these are is different levels of controls. So a patient can say, I only want these people to see my documents, or I don't want anyone to see it unless I'm there and give them access. So there's complete privacy or there's limited privacy. And so there's an audit trail as well. So you can see if anyone else, you can see who's accessing your record at any time. So you can log on and see that, and you might see that you might go to High Street Clinic, but it might be accessed by Joe Bloggs and Co. because the doctor's name or the company name that they're registered in, because they have to be registered in the same as what their they pay their tax in. Their tax file, it's not, the ABN number is what they're registered in. So often the name of the practice is different to the ABN ownership, so you might need to check that. But you'll be able to see if your doctor accessed it and when he did and if anyone else does. So it's a very tight, secure system. Practices will run audits on their own systems on a regular basis, and that's all part of the conformance that the clinical information system has to go through. Okay, so how do you access the eHealth record? This is a quick overview. Consumers can go via the consumer portal. I'll show you how to do that in a minute. There's a mobile app for my child's eHealth record, and that's available for anybody. You can just download it out of the App Store, but it's no use to anyone outside of New South Wales really, because it will be soon, so don't give up. But the eHealth record, child eHealth record, was developed as following on from one of the WAVE sites, which was in New South Wales. So it was based on the Blue Book. and not every state has blue books. I think everyone has a slightly different colour book for their kids' records under the age of 14. So there's a work currently being undertaken at the moment about putting the child e-health record nationally. So all of the states and territories are in discussion about how their e-health record would fit with what's currently there, what needs to be changed. Because I think even in Victoria, I think it's actually run by education rather than health. So that's the issue of having a national approach to the child record. But that will happen, and I suspect it will happen before the end of the year. For providers, you can all access the provider portal, and you do need your NASH individual cert to do that, and I'll show you those. The other thing is most of you will probably have access, or you might have access to clinical information systems. So they need to be conformant, and you're about to get another poll. So more questions, so you can all wake up and respond. Okay, we will be going through these results at the end. Okay. All right. So now what I've put up on the screen is how do you access the eHealth record from the consumer portal. So this is if you haven't already registered. You can go in here and you go to ehealth.gov.au, and then you go down and you can see where the circle is and you can register. It's into a MyGov account. Now, those of you that have registered, you know that it's a fairly tricky process, and one of the reasons it's tricky is because of the security. All the MyGov accounts have to be pretty secure, and they'll probably get more secure when our tax goes there next year. But don't care about health, but finance is a bit of an issue. But anyway, of course, it's very secure. And so the other thing you need to do is if you are registering or if you're helping somebody register, just make a point of knowing what you need to have in front of you when you do it, because you're going to need your Medicare number, you're going to need to know which account Medicare pays your money into, when you last went to a specialist, and there's a few questions like that. So if you're not prepared, you run away and get that information, and then it logs out. So you need to make sure you're well prepared, and that's useful information to be telling your patients as well. So what do you see on the consumer portal? So this is an overview that you can see now. So this will just give you, if you've got a shared health summary, this is what will happen. If you haven't been to a doctor and haven't got a shared health summary, clearly you won't be seeing that. So what you'll be seeing is more like this, if you haven't already got a shared health summary, is you'll just see an overview of your Medicare data. So this is, you have to tick that you want this data in your record, and I think most people have, but you can see there, you've got up there what prescriptions, so that's your PBS, any childhood immunisation, or your organ donor or your MBS data. So you can see what tests you've had when you've been to the doctor or what doctors you've been to, and also your scripts, prescription information. Okay, so how are you going to access the provider portal and what will you get? First of all, there's two ways to access your eHealth record. Not yours, you might be doing it for a patient. So you'll be looking for one of your patients how to access their eHealth record. So you'll need to either use your clinical software, which might be a medical director or best practice or some such. If you're in a hospital that's got access, I think, jurisdictions just send discharges, and some have got views, so you'll be viewing through the portal. But I think most of you are working in GP practices, so these are the systems you'd be using. ZMed's another one. So there's a bunch of systems. In fact, there's probably about 14 or so that you might have a choice of. So they're all hooked up to the system, and you can access clinical software through there. And we can go into that a bit more next week if you wish, or we will do that. Via the provider portal is difficult. So what you need to do, and this is where I think to get adoption in the likes of Allied Health and probably some of you, you will need to access the provider portal because you can see things when you go in there. You can't upload, so you can't write to the portal like a clinical information system. You can't send up a shared health summary, but you can read what's there. So I've just put up what a health record overview looks like, and this is what the provider portal looks like now if you look at it. There is work being done to enhance this, but this is what you do. Now, to access the provider portal, you will need an individual NASH certificate to go with your HPII. And you've got to log on. Each time you look at it, you need to log on with your credentials. So you're not able to leave it open, which you can for an organisation. So it's a different situation. If you're an organisation, you don't have to, every time you use your clinical information system, you don't need to log on with your NASH certificates. It's only when you access the provider portal, because obviously going in via, it's called the B2B, which is business-to-business gateway. It's a different process of getting in and out, and that's why the security is slightly different. Yeah. Some of the nurses, if you're wanting to do mobile, you might be using your provider portal. So if you're visiting people in the home, you might do that. Although having said that, some of the software is now enabling mobile. So if you say you're using Medical Director and you're out visiting someone, you can take your laptop and you can use your organisational certificate to do that. So your laptop just works as an office, as your organisation. So you're not accessing the provider portal, you're accessing the consumer record via your clinical information system. So I hope I've clarified the difference between how you access it. So to go through the provider portal is just to look at. You can print, you can't download, and you can't upload. To go through your clinical information system, you're going through a different gateway, and you can upload, download, and yeah, that's all you need to do. Yeah, and you can look if you don't want to do anything. So they're quite different avenues to get in and out. Okay, so you've got another poll. They're coming thick and fast. I hope you're all still awake. Yep, seems you are. You're all answering. That's great. Okay, so what does an e-health record look like in a system? So what I've got up here is from best practice, and I'm not using best practice because they're the best or any stretch of the imagination. I've just randomly chosen one, and this is what a clinical information system looks like. Most of you will be familiar with this, I'm assuming. So what they've got is a button there that talks about PCHR. Now, when we gave the vendors, there was a vendor panel that NEHTA was sponsoring, so we actually supported these vendors financially to build in their system the ability to connect to the PCHR. And when we did this, we paid them. We didn't actually tell them what to do because we thought they'd be innovative and smart and clever, and we didn't want to upset the commercial ability of people to gain new customers by being innovative. But as it turned out, most of them didn't build what the consumers wanted. So we got a lot of feedback from the clinicians who were using this saying it was difficult, clunky, blah, blah, blah. So what we've done is we've got a new program called the Clinical Usability Program, of which I'm the manager of. And what this is to, what we're doing is we've spoken to clinicians and they've said this is what we want. So we've created some requirements. We haven't changed the specifications. All we've done is got some additional things, and we've released two releases. We call it Cup 1 and Cup 2. So the first release happened in October, and you will be starting to see software improved now. We've had about 9 vendors that are in beta testing with the new improved look and feel, and there's another few more to come through. So by the end of the year, they'll all have much easier systems to use that the doctors and other clinicians wanted. We've just released Cup 2 this week, yesterday in fact, and that's all about event summary. So we're hoping that will get some use. I'm just looking at the time. Okay, so what information is in the eHealth record? These are the main documents that I'm just going to give you a quick overview of. The shared health summary, which is just a summary of the person's health care. Now, there's only three types of people that can send up shared health summaries, and they're medical practitioners, registered nurses, and Aboriginal health workers who are registered with APRA. So all of you are able to send up shared health summaries, and that's a really important fact, and that's why we should be getting as many nurses to be thinking about how they fit into the workflow and general care of patients. Because you need to be the nominated provider, but many of you have patients all the time, and you are the could be nominated providers. Also, there's ways, and as Julianne said earlier, things like data cleansing and stuff we will talk about next week as to how you can support the upload of shared health summaries. An event summary is an event that occurs. So if you're visiting people in the home, if you're a community nurse, for example, you might have a patient that you're seeing and you think you might see them for about 6 weeks, might be wound care or something that has a limited time that you'll be visiting them. You wouldn't put up an event summary every time you visited the person, but what you would do is at the end of that episode of care, you would put up an event summary to say what's happened, how you've treated them, and what you've done. And a discharge summary, you all know what they are, and they're coming from hospitals. Currently, most of the hospitals in Queensland, New South Wales, Tasmania, ACT and South Australia. I've just noticed a question. I wasn't going to answer anything, but if the GP is your nominated provider, can the practice nurse upload a shared health summary? Well, you can work with, if you're working with the GP in a practice and you're part of a care team, you could be a nominated provider. Okay, what does a shared health summary look like? What I've got up on the screen now is the shared health summary and how it looks. So you can see the information that is gathered for a shared health summary, and each of the clinical systems, clinical information systems, have got a pro forma of how they collect this information. So one of the changes that we made was that the information is sucked out of the system into this, and it's all ticked. So all you have to do when you're curating the shared health summary is untick what you don't want. If anything's confidential, for example, you know, if I've told my doctor I've had plastic surgery and I don't want anyone else to know, that will be unticked. It'll stay in the clinical information system and it won't come up on my shared health summary. It'll remain confidential. And then you've got your allergies, immunisations, and what's happening. So that's a shared health summary. And an event summary looks like this. We've just had an influx of event summaries because one of the things that people put up is immunisations. So everyone's having their flu immunisations at the moment, so people are uploading that in their event summary. So there's a record of when they had it and who. So that's in their system now, which is good. So, you know, that might be all that happens. If you cut your foot on coral on holidays, the doctor you go to, who's not your normal doctor, would say tetanus shot. Okay, what does a discharge summary look like? This is based on predominantly what everybody has in the different states, and so you can see the discharge is there. And there's 2 pages. It's quite a long document. Okay, so what do we talk about when we talk about the view of the National Prescribe and Dispense Repository? You can see here in this person, the first few, I think I can do some. So you can see these, oops, what have I done here? Help. Okay, I'm just trying to, I've got a red dot now. So you can see these first ones have only been prescribed, they haven't been dispensed. So, and down the bottom here, you can see those that have been dispensed. And you can actually see how they dispense them. So if you look at the bottom drug, you can see that it was prescribed as 1 in the morning, and then it was dispensed as take 1 capsule in the morning. So you can see what the pharmacist does and how it's changed. So you can have this view of your patient when you look at them, and you can see what's been prescribed and what's been dispensed. Okay, you've got another poll. That's great. It's good to see so many of you still awake. We are charging through, and I hope I'm not going too fast. There seems to be a lot of information, but we're okay. All right, so what does EHealth record, how does an EHealth record benefit nurses? Well, I think first and foremost, it's better access to your health information. So you, as a practitioner, will have more information about the patient that the patient may have forgotten to tell you, or might need prompting. So this improved continuity of care because you're able to actually share the record, timely communication. Just a recent example from a GP was that a patient got discharged from a Queensland hospital on a Saturday morning, went to the GP to get a new script for the medications they'd been given in the hospital or prescribed. The GP just looked at him and went, what? He was a renal dialysis patient that the GP had been looking after for a number of years, and he couldn't understand. He was a bit surprised that medications had been changed. The patient told him he had one of those records. He looked up straight away and he realised that the patient had had an infarct and his medications had been changed, so he was able to write the scripts immediately, and that was on a Saturday morning. So the patient was discharged, and an hour later he was able to get his scripts without any phone call to the hospital or mucking around, so it saved an enormous amount of time. And we're starting to hear many more stories like that, so that's one of the benefits. And for you as nurses, you'll be treating these patients as well, and much more informed decision-making on medical needs. The other thing is it saves time, it saves volumes, and as I said, scanning, it saves risks and costs of scanning. Some people are employing, practices are employing up to 20 hours or so. And there's many specialists are now starting to send lots of specialist letters via electronic means. So, all that envelopes and postage, those things are being saved. Okay, so just reiterating, I suppose, the benefit for patients, because the health information travels with patients, and as Julianne said, we're all patients at some stage too, as well as helping the health system, it's helping ourselves as patients. A lot of people can't remember the medical history. Often they can't remember what dosage of drugs they're on. You might be on 20 milligrams and you say you're on 40. The doctors haven't got a clue unless you have it written down somewhere. Individuals are able to update personal data and keep their own information, so they're better informed and better quality safety, and reduction in duplication of tests. So if you've got someone's blood results, you don't have to repeat it within the next week or two. You've got another poll happening. Getting muddled up here. Okay. Sorry about that. You might have had just a couple of slides on your screen. All right, so I'm almost at the end of my talking, and then we will respond to your questions. But what can you do to prepare for eHealth? So, first of all, register yourself, obtain your HPI-I, encourage if your organisation hasn't already got an HPI-O, and you can find out how to do this not only on our website, but also through the eHealth website and the Medicare DHS as well. We've got quite a nice website now, and you'll see it in a minute, the link for providers. I talk about that, don't I, Cassie? Yep. And encourage your medical practitioners to start using shared health summaries. As a result of the budget, it's here to stay. Let's get on and use it. The review has taken its toll, and I think some people haven't been using it as a result of the waiting for the outcome of the review. So we need to just restart it, reboot it, and get some use happening, because if we can get some meaningful use, we can get some data of some really good outcomes. Okay. All right, so have I just missed something? Okay, if you're working in community health setting, again, obtain your healthcare identifier and your NASH certs. Identify who your eHealth resource is. So a part of getting an organisation HPIO, you get an OMO, which I've forgotten what it stands for. There's so many acronyms in this game. You'll see the forms and there'll be OMOs, HPIOs, HPOSs, whatnot. So you will, it's an organisational maintenance officer, I'm being told. So thank you to 2 or 3 people. It's good I've got so many buddies. And then if you work in a hospital, explore opportunities to become an eHealth champion, because we really need some champions, and nurses are the best champions at all fields I've found. Outpatients, yeah. Okay, so what to do next? To prepare yourself for next week, have a look at the software demos that are on our website and just explore what we've done. There's quite a lot of information there. And I look forward to seeing you all again next week. I think I'm finishing off now, aren't I? Oh, no, I'm going to answer all the questions.
Okay, I'll help. Do you want me to help you answer them? Or? Okay.
What I've got up there is, Cassie might want to talk about the NEHTA Help Centre. If you send anything in to help at NEHTA, send any sort of question you like, or phone that number, 1300 901 001. So what happens then is we will triage it if we can't help you. So if there's any questions that are to do with HI, we will send them across to DHS. We do a warm transfer, or we can send them an email. We try to get back to you relatively quickly, and we've got people monitoring how quickly we get back. I get emails and they say, have you done this? So send it to help at NEHTA or phone, and so we will triage. And Medicare locals are still around for another year, and they're extremely helpful. They've got people who know all about eHealth, and many people say how supportive and helpful they are with supporting assisted registration.
Just wanted to add there as well, one of the things and one of the questions that I'm just following down through for one of the questions that, sorry, I'm just looking at, was it Jane? Jane was asking a question about Medicare locals and whether they will be able to help with registration. They've got a lot of other things that they're probably going to be working on in the next year, so I'm also wanting to encourage you to give the Help Centre a call, our 1300 number, where 1300 901 001. The team are very experienced at helping with registration support. A lot of your organisations, if you're working in general practice, probably have already done a lot of registration, but there will be those opportunities where you can encourage your organisation to get on the eHealth bandwagon, as they say. So yes, I want to plug that number again, because as Heather was saying, we can triage the call. Often, it could be even if you've got some troubleshooting issues or anything. Often we can triage those calls. We can determine what the need, what you're needing and what you require, and then we can forward that on. Okay, so let's just answer some of these questions. Karen B has asked, if I change my place of work, do I need a new individual PKI certificate? Your individual PKI certificate is yours. It's yours that you carry with you all the time, and each time you go to a different organisation. So if you're working in 3 different places of work, so you might be working in a hospital setting, a GP, and you might be doing even some mobile work, going into to various homes and everything, you would then need to take your USB card, or it's actually a little dongle, and authenticate yourself each time, so that you'd use your PIC code, and that's how you are able to access the provider portal. If you've got it, even if you've got, as another gentleman has asked about whether it's on your device, so if you do have, like Heather was saying, you've got a laptop, you've got your conformance software on that laptop. You can use the conformance software on the laptop, and you can access the PCH that way. If you want to if you want to access the provider portal, you would still then need to authenticate yourself with your individual NASH cert. So if you can just remember that if you want to do the provider portal and it's a mobile, particularly if you're mobile and you don't have that conformant software on your laptop, you would then always with your provider portal you'll need to use your individual NASH certificate. Okay.
Which means currently iPads and iPhones you wouldn't be able to authenticate your NASH cert. So it would need to be a laptop if it was mobile. Now, there is work being done to try to make that easier, but it's not going to be this year.
And Jodie C was asking a question about, if you're, could you upload a shared health summary if you're an RN or an EN? If you're part of the care team and it's agreed that, you can be part of that care team, you would then become a nominated provider and be able to upload shared health summaries or event summaries.
Only registered nurses, not enrolled nurses. Thank
you, Heather. Okay, I'm just having a look at some of the other questions. Mary A. I was given a USB and an HPII in 2012 but never got a certificate. I'm now at another practice.
You should chase that up because I think some of the, although you should have got a letter if it's expired, give DHS a call and ask them about that. Your HPII is still the same. You don't need to do anything about that. That stays with you forever. And you've got a USB, yes. Ring them up and see if it is still there. It's probably okay, but just check with DHS. And tell them, yes, is it an organisational USB cert or is it an individual NASH cert? Sometimes the individual NASH certs have been taking a couple of months, sometimes up to 4 or 5 months to be returned. So when all the general practice people were registering, DHS was absolutely swamped, but I think they've put extra staff on. You also, those of you who do access systems, the system will know that DHS's HPOS has predominantly been used for costing and getting money for Medicare claims. HPOS, the practices would get the money that way. They're doing a lot of work on the usability of the HPOS, and it's now, I'm not sure the time frame, but it's certainly being, a lot of work is happening to make it easier to get everything online rather than paper. And I think they've got the online thing already. Sophie, you're there. Do you want to just tell me it's done?
So just to answer a couple more questions about whether the presentation slides will be available. They will be available on both the NEHTA website and the APNA website after each webinar. So in a couple of days you'll be able to access these slides, and we really encourage you to register for the next webinar, which is next Thursday, same time at 12 o'clock. And the link is just provided here in the slide. If there aren't any other questions, I'd really like to...
I'll just respond to Jane. Quoting the stats for the clinical docs, just say round figures, because currently they're not being made public as to how many are around there. But I think it's important to know that you've got those sort of numbers in there. So if you just say an estimate is that many numbers.
And, we've got a final poll.
Can I just respond to Karen B's question around software providers not supplying the facility for nurses to register their HPII? We might need to take that on notice, unless, of course, Heather or Kathy can answer that at the moment. But previously, APNA has certainly been following this through.
Yes, there was a couple of... that's right, because there were some of the vendors who only had availability for a medical officer. That's the one, isn't it, Julianne, I think?
Yes, it's very frustrating for the nurses.
Okay. We have followed that through, and I think they haven't changed it?
Not in Medical Director, I don't believe.
Okay, Medical Director's about to do a new release. I'll follow up and find out if they've changed it. I thought we had spoken to them and they said they would, so it could be in this release.
And there was another question just finally about pathology and whether with pathology would the patient see the results before the GP. That's actually in Release 5, which is still being, the whole sort of specifications and requirements are being embedded at this stage, so that's an answer that we can provide later once that's sort of been finalised.
Yeah, that's one of the stakeholder issues that's happening is who owns the results. So does the pathology put it up, does the doctor put it up, and when can the patient see it? So they're the big issues, because at one stage they were thinking of an authority to post. So, you know, when you go back to your doctor to see them about the pathology results, that's when it'd go up. Well, most people don't go back unless there's an abnormality. So how would that work? And now you're not going to pay $7 to go back to your GP just to look at results. So the consultation is currently occurring with pathologists, doctors and other people. So it's not been finalised as to how that will work, because, you know, there's a lot of research, particularly out of the States, is that, and there's another, patients can see their results if they're okay. What's the point of withholding them? And they've done that quite successfully. And the other thing is, you know, another option is the doctor just looks at them and gives permission to when it goes up. But anyway,
I'd like to hand over to Julianne to do a sort of final wrap-up of today's webinar. Thank you so much for attending. I hope you found it worthwhile. We do have an exit survey coming that will be shortly sent to you. I really would encourage you to complete it. It'll help us, you know, improve the way we present and provide the right information for you and make it meaningful. And as I said, thanks again for your time. Over to you, Julianne.
Thanks so much, Cassie. In closing today, I would like to shamelessly plug our national APNA conference, Thriving Through Change, which is on later this month, the 29th to 31st of May at the Hilton in Sydney. Certainly NEHTA and EHealth will feature along with many international and national experts. And most importantly, it gives opportunities, they just abound, to network and hear from your nurse colleagues. APNA is also delivering workshops around Australia and, importantly, showcasing and leading discussions around not only nursing in general practice but e-health in those as well. So just go to our APNA website, www.apna.asn.au, or just Google APNA is the easy way. Thank you once again for joining us today. I do hope this has helped you better understand e-health and the National e-health records, and in particular the vital role that we as nurses can and do, and maybe many of us already are, playing in this e-health space. So I hope it has given you a thirst to find out a bit more and to connect both personally and professionally with e-health. And please join us next week for what I see as the practical webinar with the how, when and where, and with scenarios around planning and preparing and investing that time up front for future benefits that we all quite aware of. So once again, on behalf of APNA and Primary Healthcare Nursing Workforce, I'd really like to thank NEHTA and our colleagues Heather and Cassie, and most importantly, I thank you for joining us on the exciting e-health journey. So thank you so much for joining us today.
Thanks.
Thanks.
Thanks, everybody, and see you all next week.
See ya.